most famous physical therapist on the internet.
Well, hi there, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of course, Bob.
So, neck pain. Should you wear a neck brace? Well, if so, you should do this. And this is, we're going to get right into it, Brad. So, neck braces are cervical collars or C collars. Cervical meaning neck. They support the neck. They often support and protect the spinal cord that runs through the neck. That's very serious if it gets injured.
Yep.
And it also supports your neck and it limits motion of the neck.
Sure.
So it's really good after, like for short-term recovery after like surgery,
Yep.
injury, or if you had like a traumatic event like
Yeah.
a motor vehicle accident or a sporting injury. And you'll see people, on the TV shows where someone gets hurt and they right away they put them on the board and they,
Right. And that's a very different situation than compared to like they're seeing us after the fact,
Yeah.
after the injury.
I often, when I seen a lot of them too, is with people who had whiplash.
Sure.
As they're being in a motor vehicle accident. Now, it's less often used with a pinched nerve of the neck or with neck arthritis or just general neck pain or stiffness.
Right.
In fact, I would say, I hope I'm not speaking for you here, Brad, but I've never really used a neck brace in that instance.
You personally or with your patients?
No, with my patients.
I'm thinking the same thing. It's very rare. The exception is wearing neck braces after surgery or
Right.
specifically ordered by the doctor.
Right.
I've never suggested that a patient wear a neck brace, with the exception of
I've had a whiplash person that was bad.
Yeah.
Like I said, oh, maybe you want to talk to your doctor about using a brace because she couldn't sleep.
sure,
She couldn't.
yeah, but
So-
generally not. And actually, the exception I was thinking of with dizziness.
Oh, right.
And you're wearing
vertigo.
it for different reasons.
You wear it one night or two nights.
Yeah, and it's not because of your neck.
We do that all the
different,
time.
Different
actually.
reason.
Yeah. So in whiplash, one study showed that actually the braces may not be any good. That early movement is better. But again, as I already said or alluded to the fact that if you're not getting sleep and you're in so much pain, the brace gives you some relief. Go ahead and use it. And then they of course found studies that were the other way around.
So
You know.
whiplash, because I think some people may not know.
Right,
I
sure.
really didn't. You're in a car or in a seat, you get hit from behind, and you could do this, and your head really goes just bang, and then it comes forward. So your head's going like the end of
a
a
whip.
and there's a lot of force going.
And
through
you
that
actually
spine.
tear the muscles quite often.
Yeah.
And that's what I found. Like I've had people with their whiplash, like they felt like they can't even hold their head up on their neck.
Sure.
Because the muscles weren't working. And we're going to show you some things to try for that, especially whiplash.
It's not near so common now because they have the headrest. For
Right.
many years now.
Yeah,
That's why they put
can hit
that
that. Right,
in cars.
exactly. Good point, Brad. But in most cases, the doctor makes the decision whether or not, like you said, in trauma or surgery. They have hard collars and soft collars. The hard collars are made out of like plastic or plexiglass, and they often have a chin support.
Yeah.
And they're better at limiting motion, but they're not as comfortable.
Yeah.
So the soft collars are more comfortable. They're felt foam or rubber, and they conform better, but they don't prevent motion as well. So
Much easier to put on and take
yeah,
off.
much
too.
easier. But if you're having like trying to protect after surgery, most of them you find is in a hard collar.
Yeah.
So, if you use a collar, again, we recommend trying to get out of them as soon as possible. But quite often, your doctors are going to determine that. After you get out, there's often increased stiffness and also strength, decreased strength. So we're going to show you just the range of motion exercise you should do after you come out, if it's okay with your doctor, and the strengthening exercises.
Right.
So let's start with range of motion. The first thing you want to do is always doing that. You want to do it from that angle, Brad.
So if the doctor says go ahead and do any range of motion that's tolerated, that means that does not create any pain. Maybe a little stretch pain, but no sharp pain.
Right. So we usually start with chin tucks, and that's where we're kind of just working the upper cervical spine or upper neck. And you're going back, you're backing your head up, and you're not going down, you're not going up, you're just going straight back. There might not be much motion there to start off with. And then you progress to neck extension. I think I'm going to have you show it, Brad, because
Sure.
you got it. I usually like to use a towel just because it gives them support to
Yeah,
start
it's
off
more
with.
cushy. One thing that we have to mention is before you do any neck range of motion exercises, you need to be in good
Very
posture.
good posture,
Yeah,
as good as it can be.
if you start out slouched,
It's not going to work.
it could cause problems.
Yeah.
So here we are sitting good. We're going to put this around the neck, and a towel roll to start out with can work out well. As you get more flexible, something less bulky, like maybe
Yeah.
a belt or a strap.
Yeah, we got the Bob and Brad stretch out strap here. This works out really well because you can get right onto specific levels.
And if you have hand problems, arthritis,
Yeah.
the beauty of that is you don't like here you have to grab and hold, and some people have problems with that, especially if you're older. And we're
Yeah,
just
or you can go
stretching
hands
back.
down too, or hands up.
Yep. And that depends on what's more comfortable and your shoulders as well. Some people have a hard time doing that if you're older, particularly.
This is a motion that quite often gets limited when you're in a brace. Is going back like this, and it's important that you reestablish that.
Right.
Now you eventually want to do it to the point where you don't have the towel or the strap.
Sure.
You go ahead and you can just get good posture and then work on going back.
You might put your hands
Put your
back,
hands there. Good point, Brad.
lean back into the chair and use that. It just needs to be relaxed again, pain free, just gentle stretching or gentle stretch pain at the most. And I just worked with someone over the weekend, and she said, "I was taught you're never supposed to look back and up
Yeah.
like this. It's hard on your neck." It's farthest thing from the truth. You got to follow the rules. No pain, gentle, and your neck is made to look up.
Now that's not to say that if you look up for hours, you might have pain. Like if you're painting, you could
Yeah.
jam the joints if you're
Sure.
painting for a long time.
Right.
So.
And obviously, after an injury or whatever, you're listening to your
Right.
body or the doctor.
Neck rotations. You want to get those rotations back. So you're going to work on turning to the right and turn to the left. Again, very good posture when you're doing these. You can do a little bit of stretch, gentle. You can put one hand behind the head and one like this and give a little counter stress.
I always emphasize to my patients, fingertips
Yeah.
only. You're not going to get your whole hand and crank on it.
If you got the
Very
fingertips, it's
gentle.
pretty hard to put too much pressure on there. And if it increases pain, you don't do it.
Right? Exactly right.
If your one direction works better than the other, work on that one direction for a while and then check that other direction
Sure.
out. The final rotation one or range of motion one is neck side bending. So chin tuck again, kind of, and side bend to the right, trying to put that ear on the shoulder. Don't lift the shoulder up to it though. Do leave it down. And Brad's fingertip rule also applies here. You can take your hand with the fingertips on the same side that you're bending to and just gently bend to the side.
The most common mistake with this one is I have patients, they look down like this.
Sure.
I know that. But you want to keep looking straight ahead and ear to that shoulder, ear to that shoulder is my verbal cue.
So this is the beginning strengthening exercises for the neck. Works really good with whiplash. I don't know if you remember this, Brad, but
Isometrics?
Isometrics.
We did a video on this back in
32.
Yeah, it was quite a while ago.
But yeah, I know they've done many studies on this, and that isometric strengthening is probably one of the best things you can do for whiplash. So you're going to go in all the directions here. Let's first do flexion, Brad. So you can just put your hand on your forehead here and prevent yourself from going forward like this. And by doing that, you're going to strengthen the muscles in the front that flex the neck.
And if it hurts, if you push really hard, don't push
Don't
really
do
hard.
it.
Start out, it should all be pain-free.
5-second holds,
Yep.
and you do 10. Then we're going to do extensions. So going back, put your hand behind your head. And 1, 2, 3, 4, 5.
I think you could,
1, 2,
if you wanted to be a little lazy, put your chair up against the wall and use the wall.
There you go.
Just an option.
Sure. You could do rotations. So you can just put your, just hit my mic. Put your hand on the side of your face, and you stop yourself from rotating to the left.
Most people don't wear mics, so
Yeah,
shouldn't be an
that
issue.
should not be a problem. And then the last one, Brad, is side bending. So you
Ah.
just put your hand on the side of the head and prevent yourself from putting your ear on the shoulder.
Yeah.
5-second holds on all of these times 10. And you'd be surprised. It makes a difference because you usually don't do strengthening to your neck. And so it doesn't
But-
take much to get
Yeah,
some
the
gains.
collar is one of those things that it's going to take a lot of strength. Plus all the pain, the injury, and the pain
Yeah.
muscles relax, and they fatigue and relax and weaken very quickly.
Yeah, you might have, and you may have tore some of those muscles, and they're repairing, and it helps when you strengthen them as they're trying to repair themselves.
Right, exactly.
All right.
we
Remember
done
Brad,
already?
Yeah. Remember,
Wow.
Brad and I can fix just about anything.
Except for
A broken heart.
right, but the neck is we're on that.
Yeah. Thanks for watching.
I don't-